retraction technique. First thing we do is have the assistant place Vaseline on the patient's lip, and especially place them in the corner of the lips. These retractors protect the lips and also keep the lips out of the way. When you place these, there's a technique. Use your mirror to retract the cheek on that side, then place this retractor, then come back with the other side. And this is good when you're working in the front of the mouth. This one's hard to work with if I'm working on back teeth though, because this gets in the way. When we're working on back teeth, use these single retractors, and you again retract with your mirror, and then I can work back here, or you can retract the other side like this. Working on upper teeth using this, we call it the skinny mirror. Something else that's very, very helpful, we call them tooth rests. This is a large and this is a small. Try to use the large if I can, because it gives you more vertical space to work. And it's easier for me to work with this mirror than it is this smaller mirror. Working on the left side, Louisa, or my assistant, will use this retractor, and I'll place this here, and then she'll blow air on the mirror. Working on my side, I'll place that and use either the small end, sometimes that's easier, it gives you more space, and then I'll work with this mirror, to me, more easily than using just one of these small mirrors. On the lower teeth, if we're working on my side, then I'll use either my mouth mirror, will work like this, or more often than not, I'll use a single retractor, either the large end or the small end, just because it gives me more space for the handpiece. And Louisa will retract the tongue with her mouth mirror. Now, the objective of retraction of the tongue is not to pull the tongue away, is to keep the mirror, the head of the mirror, between the tooth and the tongue, so the handpiece burr does not cut the tongue. And it keeps the tongue out of the way, but you're not trying to pull it over. You're just trying to put the mirror part of the mouth mirror between the tongue and the tooth. So if we're working on the other side, then Louisa will use the retractor, and I'll use the mirror. And see, I'm just putting the mirror between the tongue and the tooth to keep the tongue away from the burr. I won't be using a mirror on the bottom. I'll just be looking directly. If we're working in the front of the mouth, then that's when we like to use these double retractors. And I can work on a front tooth here, the front teeth down here. So that's the Dental Minute. These techniques work, and they work every time.